Hey everyone, Aubrey here at Portalupi Orthodontics. I am the treatment coordinator. Recently I have started some Invisalign treatment and I have been walking you guys kind of through the process, going through my own treatment and giving you some feedback on sensitivity, soreness, pros and cons of Invisalign, basically just the whole thing. So what we are doing today is scan day. So anytime a new patient comes into Portalupi Orthodontics, we always like to use our iTero scanner. It's a very high-tech piece of equipment that we absolutely love. Numerous reasons, and I'll go through some of them with my case, and you'll be able to see, why I want a treatment, and I can explain to you certain things that the iTero offers us. Now, what you see Shannon doing when she's doing my scan is that she's taking that wand there and she makes a couple of sweeps along the lower, and then the same thing across the top, and then in just a minute you'll see her doing my bite. The really cool thing about this process is that it gives you this image here of your mouth, and it's very accurate, shows fillings, crowns, anything like that. And the nice thing about this is that you can split it into two and zoom in or zoom out. I'm gonna zoom out just a little bit so you can see my arches. Now, in all honesty, aesthetically, from an aesthetic point of view, I don't have too many complaints. My teeth are pretty straight. They look pretty nice. I'm pretty happy with that. For me, treatment isn't necessarily about making things align nicely and look nicely. I'm very happy with it. My treatment is more based on my bite. And this little guy right here that I'm gonna press is called an occlusogram. Now what this helps show, this is a really neat feature that the iTero offers, is that it shows you your bite. Now, sometimes people come in and they need ortho and they want Invisalign or standard braces because aesthetically something bothers them. They have a little bit of crowding, spacing, things like that. For me personally, my bite is off. So if you were to take this, the occlusogram shows you where the strong points and the lighter points are when it comes to your bite. For me, on this right side, I am biting slightly harder than on the left. Now, what does that do? Why is that important? It's really important because it can throw a lot of things off. One, it can make these teeth on the right-hand side very sore. You can get some sensitivity, cold, hot sensitivity, where they can get a little achy. And then also what it can do is it can also affect your jaw joint. So when your bite is uneven, you want to think about that as the foundation to building your house. So if your foundation is uneven, the house is not going to be stable, plain and simple. So for me, getting started with Invisalign, I'm super excited, not necessarily an aesthetic point of view, but more of an oral health type of thing. And I am excited to walk you guys through. When you are a new patient and you come through Dr. Portalupi's office, I can't wait to show you this little piece of equipment. It is so cool and so informative. And I just want to thank you guys for following along. Again, if you'd like to email me any questions, please feel free to do so at aubrey@drportalupi.com, and I'd be willing to answer any questions that you have about my own treatment and its relation to yours. All right, you guys have a wonderful day. Thank you.